the HIV community, researchers, advocates, people living with HIV have always been at the forefront of grappling with the problem and moving forward. So I want to be sure that we don't sit in Kigali and think what could have been and give up. A couple of things need to happen. One, in December, the Global Fund to fight HIV and Malaria and PEPFAR jointly announced an ambition to deliver LEN to 2 million people. Now, we were actually pushing for an even higher ambition, but 2 million people on LEN within the next couple of years would be faster than any previous prevention scale up. And the good news is that the Global Fund, as recently as last month, recommitted to that ambition. Now, originally it was going to be a grand partnership between the Global Fund and PEPFAR. PEPFAR is still around again for a much smaller swath of people. So we have a gap of how to deliver to 2 million people. But the Global Fund is committed. I think a lot depends on the Global Fund replenishment that takes place over the next 12 months for their next 3-year cycle. And I think we need to use the lenacapavir as a catalyst for investments in the Global Fund. Not because lenacapavir is perfect, but innovation matters. And I think, in the conversations of the last couple of years now, we've talked a lot about the need to get to sustainability, this idea of domestic resources being mobilized, of having a sustainable response. And I would argue that prevention generally, and lenacapavir in particular, is core to sustainability. Because if we now think, especially with USAID leaving, as governments think about how to keep their entire population of people living with HIV on antiretroviral treatment, and if we're adding 1.3 million new infections every year, the need to stop, the proverbial turn off the tap is critical. And LEN is our best shot, truly, at beginning to reduce the number of new infections. So part of this is telling governments that if you invest in lenacapavir now, you'll be able to sustain your treatment program because you're going to have fewer people joining the treatment role. And that's different than people saying, oh, we can't afford lenacapavir because it's new and expensive, and we don't know how to introduce it. So part of this is making it the sustainability issue. So as I say, one is to get the Global Fund replenished. Two is to make it part of sustainability. And the third, I think you alluded to, and that is, what is the delivery system? Now, we've talked a lot over the last couple of years about needing to make PrEP and prevention simpler. It's gotten very complicated, and more complicated than it needs to be. Now, this was beginning to happen with oral PrEP. It was beginning to move outside of the clinic and being very innovative. And then along came COVID, and now along came the challenges from the US government. And along comes a new innovation that's an abdominal injection. So it's not the easiest thing to think about outside of the health system. But I think we still need to focus on this simplified delivery, making HIV testing really simple, helping people get the product perhaps in mobile clinics and in other more community-friendly mechanisms than having to go in to a traditional primary care facility. There's going to be a lot of stress on the system because of the absence of US government support. So we have to be really creative. So replenish Global Fund, make sure that prevention is core to sustainability, and simplify the delivery models of PrEP. And I think if we do those three things, we really can meet the ambition of the 2 million people on LEN, and actually begin to bend the curve of the epidemic. But it's going to take a lot of attention, a lot of focus.